Let's discuss what we had just seen. Even though the help was there, Allie was experiencing significant barriers to taking advantage of the help she needed. This is a common problem when addressing early psychosis. So, what are the barriers to accessing early care? A few common reasons do emerge. The first is a fear about the diagnosis. A patient may be aware that they need help and be active help seeking, but at the same time be afraid of the impact of diagnosis or what their symptoms might mean. It's very common for people to feel insecure from how their experiences may be perceived by others, which is why a patient with psychosis can also feel wary about disclosing. Another common reason stems from the cultural factors, rituals, and beliefs that the patient may hold. After successful treatment, Allie later reveals that when she first started hearing voices, her grandmother consoled her by explaining that it was the spirits of their ancestors trying to communicate with her. This actually comforted Allie, who sometimes even enjoyed hearing them, until the whispers started to say critical and hurtful things to her, and they grew into something more than she could handle. If they'd remained whispers, she claims that she probably would have carried on and not be bothered by them. Ultimately, when assessing psychosis, it's important to consider the cultural contributions within every patient in order to avoid pathologizing or misunderstanding it. Of course, it's impossible to be familiar with rituals and beliefs of all cultures, so it's important to include someone, often a family member or a friend, who's familiar with the patient's culture during assessment. A third barrier is the patient's physical and social environment. For example, if a patient reports being afraid of leaving the house, is it psychosis or is the neighborhood unsafe? Are others living in the same area taking similar precautions? Rather than forcing the patient to commit to a particular course of action, it's important to examine how the patient's environment affects her lifestyle and which treatment plan will best adapt to that environment. Finally, many medical professionals display a sheer lack of knowledge when dealing with early psychosis, or report a lack of confidence in discussing their concerns about psychosis with the patient and their family. Medical professionals may be wary of raising the question of psychosis, preferring a watch-and-wait approach to see if psychosis fully emerges. However, as we have seen, the earlier treatment starts, the better. And so we encourage all medical professionals to refer for a thorough assessment if they have concerns. This can be done in a supportive manner, and when assessing for early psychosis, it's important to incorporate a strategy of helping patients feel more confident about disclosing, of assuring them that they are not alone. This strategy is called normalizing. An example includes explaining to the patient that the specific stressors in their lives are not uncommon, especially to other patients experiencing psychosis. Normalizing techniques are effective in supporting people to talk about their symptoms. As mentioned earlier, however, psychosis exists on a spectrum, and in effect the symptoms of psychosis exist on a spectrum as well. Symptoms that place the patient at an increased risk of developing psychosis in the future, but do not cross the threshold of full psychosis, are referred to as attenuated. They are weakened versions of full psychosis, which occurs when the patient has 100% conviction in their delusions or hallucinations, and when these beliefs impact their daily functioning. So far, Allie is experiencing attenuated symptoms, placing her at risk of developing psychosis. She still questions her symptoms and does not show 100% conviction in the experience. This normalizing approach is important to reduce the anxiety of the individual around disclosure of symptoms. It can be especially difficult for a patient to talk about psychosis, and so normalizing may help a patient realize that they are not the only person to have experienced these symptoms. Importantly, it also allows us to understand the symptoms as something that may be a response to stress, fatigue, illicit substances, and other stressors that are common to young people. Additionally, it is important when assessing these symptoms to do so in the same way that you would assess sleep or anxiety. That is, in a natural and relaxed manner. Only by demonstrating that you, the medical professional, are calm and collected will you increase the chances of the patient assessing the care she needs. Now let's go back to Allie's story, where her symptoms are still deteriorating and she finally seeks out the help she needs.